Necrotizing fasciitis. If it gets you, you're in trouble. Necrotizing fasciitis is a highly aggressive and very rare bacterial infection that proves fatal in many cases. Approximately 600 to 700 cases a year arise in the United States. Treatments are available, but the infection must be caught in the early stages for the highest chance of survival. Necrotizing fasciitis is commonly referred to as flesh-eating bacteria. Many cases regarding necrotizing fasciitis are gruesome and make headline news. What are the major causes of necrotizing fasciitis and what makes this infection so rare? Today I will be informing you about the bacterial infection, necrotizing fasciitis, an infection that rapidly causes the deterioration of human soft tissue and how it becomes life-threatening. Now I will discuss the causes, risk factors, and symptoms, as well as treatment options. According to the National Organization for Rare Disorders, necrotizing fasciitis is caused by either one or multiple different types of bacteria that affect the tissue just beneath the skin. The most common strain of bacteria that causes NF is Group A strep. Group A strep is the same bacteria that causes people to get strep throat. Group A strep is carried by most humans in their nose, their throat, and on their skin without showing any symptoms. Group A strep only poses a threat once it penetrates the body. Group A strep usually enters the body through external injuries, such as cuts, bruises, and other small injuries. Perforated internal organs are also a common way for the bacteria to enter the body. These organs include the rectum, the colon, the anus, and the genitalia. The most common site of NF on the body is on the limbs. Actually, in 58% of all cases, NF affects the areas of the lower and upper extremities, as you can see right here. Next, I will discuss the signs and the symptoms of necrotizing fasciitis. According to the National Organization for Rare Disorders, necrotizing fasciitis early symptoms are often mistaken for other illnesses. These symptoms include fever, sore throat, stomach aches, nausea, diarrhea, chills, and general body aches. Redness and pain are also common symptoms. If necrotizing fasciitis progresses to the later stages, there will be enhanced symptoms. In the later stages, fevers as high as 104 degrees Fahrenheit are common. Pain in the infected areas becomes fierce and sharp. The affected area may appear to be bright red, purple, it might become shiny, and blisters may appear. Unfortunately, only 15 to 34% of patients have accurate admitting diagnosis, and this causes them to reach the latest stages of NF. In the latest stages of necrotizing fasciitis, the people will become very weak and confused. The person may lose consciousness, and the affected areas may swell to several times the normal size. The areas may even split open. Pain will slowly subside as the nerves are destroyed. Eventually, the skin will turn black as the skin dies. Eventually, the patient's vital organs shut down and they die due to toxic shock. Death is imminent. Now that I have discussed the signs and the symptoms, I will discuss the risk factors and the treatment options. While anybody can contract necrotizing fasciitis, there are some groups of people that are more likely to get it than others. According to the Center for Disease Control, most people that contract NF have other health problems that lower their body's ability to fight the infection. Some of these health problems include diabetes, kidney disease, cirrhosis of the liver, cancer, and obesity. People that are over the age of 60 are also more likely to contract NF than people that are younger. There are few treatment options, but immediate action is necessary for the best chance of surviving NF. Early diagnosis and aggressive surgical treatment are necessary for survival. Surgery was required to remove the infected tissue from the rest of the body. NF spreads extremely fast, so surgery is required almost immediately. After the surgical removal of the infected tissue from the body, the next step in order to recover is antibiotics. Doctors or surgeons normally place patients on IV antibiotics after the infected tissue is removed in an effort to prevent the infection from spreading anymore. This is normally the only course of action to cure NF. Unfortunately, it is common for a lot of people that have NF to require multiple surgeries, and antibiotics in order to fully get rid of the infection. Even people that have the best treatments for NF have a high chance of succumbing to the infection due to how aggressive it is. 20 to 30% of all cases regarding NF end in fatalities. As you all can see, necrotizing fasciitis is a rare but extremely aggressive bacterial infection that takes the lives of many people that contract it. In conclusion, today I have informed you all on the bacterial infection, necrotizing fasciitis, an infection that is highly aggressive in nature, spreads quickly, and causes the necrosis of the soft tissues in the human body. I have explained the causes, the signs, the symptoms, and the treatment options. This infection is very rare in the United States and requires immediate action in order for people to recover from it. Not many people know about necrotizing fasciitis, so informing them may save a life. With more people being knowledgeable on this infection, we can more effectively diagnose it and save lives in the process. My name is Connor Livingston, and thank you for listening.